Alright, this is lumbar phase 1. L10 exercises is the active range of motion of the lumbar spine. First we will do extension. You can have the patient just kind of put their hands on their hips, and I'll show from the side angle here. Feet are kind of shoulder width apart, good posture. Hands on the hips, you just have the patient kind of extend back. Some patients will kind of pull this number, go back. We just kind of want a slight stretch. Looking slide up, you don't have to have them stretch their neck all back. Just hold that position for about 5 seconds. Do a little extra push at the end, and then back to neutral. We'll do that 5 times for 5-second hold. Then, next we'll do lateral flexion. You can demonstrate hands on the hips or one hand up high, just to kind of open this up here. And you can kind of slide down that leg. Should feel a stretch over here. Hold that for about 5 seconds. A little extra push at the end, and then back to neutral. We'll also try the other side. You can just do hands on the hips if the patient's in a lot of pain. So we'll just go to the side. Hold that for about 5 seconds. Sometimes you'll see the patient come forward. We want to keep the body in a straight line. Just come to the side, 5 seconds, a little extra push at the end, and then back to neutral. Next, we'll do seated rotation. So you have the patient scoot to the edge of the chair. We'll kind of cross the arms. We're going to twist to the side. The neck stays in line with the body, in between the shoulders. Hold that position for 5 seconds. A little extra push at the end, and then back to neutral. Then we'll rotate to the opposite side. 5 seconds. A little extra push, and then back to neutral. Next exercise is L11. It's the hamstring stretch. We're going to teach this seated. You have the patient sitting upright. You have one leg out straight. Toe is kind of pointed up in the air. Sometimes you'll see him, the knee slightly bent or the toes facing down. Try to get that toe up, full extension of the leg, good posture. We'll kind of bend at the hips. You should feel that stretching behind the knee. Hold that for 20 seconds. And we'll kind of work up to 30 seconds. We'll, hold that stretch. A little extra push. And then back, and then we'll switch legs. Good posture, bend at the hips. You feel it stretch. Hold that position. Sometimes you'll see the neck come forward. Just try to make them just look straight ahead. It's fine. And that's the hamstring stretch. Next, I was going to show you the piriformis stretch. You have the patient sit at the edge of the table. You'll slide their leg around. Try to get that knee centered in the table here. You see it centered right in the middle of the table. Use your arms to grab each side of the table. You're just going to lean forward. You should feel a stretch in the hip and buttock area. Hold that stretch for 20 seconds. A little extra push at the end. And you kind of walk yourself back up. And we'll kind of reverse legs here. So we're going to sit on the edge. Twist the leg around to where the knee's centered. Grab the edge of the table here. Just kind of lean forward. Right to where your shoulders are in line. Right in the middle of your knee. Hold that stretch for 20 seconds. A max of 30 seconds. Next stretch would be the hip flexor. We're going to use the chair method. I'd say the affected leg is the right side. You'll have the left leg up on the chair. Toes are pointed straight. So you don't want the toe pointed out here or this one pointed up this way or inside. So the toes are pointed straight. With the body line. We'll do the hands on the hips. Just going to lean forward. You want to feel a stretch right here, you just have to lean back just a hair. Bend into it. You should feel a stretch right there. We'll try the right side. The left leg was the affected one. Hands on the hips. Toes are straight. Good posture. Leaning forward. Have them lean back just a little bit. Hold that position about 20 seconds. Should feel a stretch right here in the hip flexor. Then relax. Next exercise, let me grab the physio ball real quick. And this is with the eyes open. I'll have the patient sit on the ball. With this exercise, the core is engaged. We want the core nice and tight. And then first we'll do a counterclockwise, clockwise. So it's key to have the core tight. We want the hips doing all the movement. So if we're doing circles, hips are doing everything. I'm not letting everything move like this. Hips are doing the motion. And then we're going to do the opposite direction. And then we'll do forward and back. So it's all hips. And then side to side. All right, the next stretch is at the table. This is the QL stretch. Let me put the ball away. We have the patient laying supine. Knees together, feet together. Hands are just relaxed here. You're going to have the patient let their knees sway to one side. Try to keep your shoulders on the table. You don't want your shoulders coming up. Should feel a stretch into the hip and low back area on the opposite side that you're swaying to. Hold that position for about 10 seconds. And back to neutral. And then we'll sway to the opposite side. So you should feel a stretch right through here. Hold that for 10 seconds. And then back to neutral. That is the QL stretch. Next exercise is the pelvic tilts. This exercise, the patient is also in supine. You're going to have the patient, just knees are bent in a relaxed position. You're going to tell the patient to tighten their stomach, draw the belly button in, and flatten your back on the table. So you kind of notice that your pelvis will kind of posteriorly rotate. Draw your belly button toward your spine. We're going to hold that for 5 seconds. It's key to tell the patient to breathe through this exercise. They don't have to hold their breath while they're tightening their stomach. We're going to start with a 5-second hold. And that is what you call the pelvic tilt. Alright, the next exercise we have is the single and double kneaded chest. So we added a few exercises other than the 6 that you can also add with patients. This would be a progression from a pretty sore patient from a pelvic tilt and the QL stretch. So you have the patient laying on their back. You're just going to have them wrap their hands around the back of their leg, behind the knee. You're going to pull the knee towards their chest. Let's just open the space up in between the vertebrae, mainly just stretch here. Hold that position for about 10 seconds. Just a slight stretch is what we're shooting for. Sometimes you'll see the patient kind of lift their neck up. It's key to just Have them relax. This stretch is only for the lumbar here. And sometimes patients will have legs straight. It takes pressure off their back if their knees bent. So 10 seconds, relax, and then switch. Hold for 10 seconds. And then relax. Usually we'll do 5 on each side. It's a good starting point for that exercise. With the double knee to our chest, same idea, we'll wrap the knees, hands on top of the knees, so you can have them bend up like a crunch, then here, and then kind of relax. Bend it towards your chest. Hold that for about a second or two, relax. Second or two, relax. About 10 to 15 of these. Just make sure the neck's not coming up. Just in a relaxed position. Next exercise we added was the bridges, double leg bridge on the table. This one we're going to start with the feet apart. Wherever the hands feel comfortable, they can be placed. The key is to have the patient lift their hips off the table. You want their body in a straight line is the goal. So if they're here, and that's as far as they can go, make sure you make a comment in the PT flow sheet that they're only halfway. So we really want kind of straight. We don't want them past, we just want a straight line here. Start at a 3-second hold. And then back down. That's where the bridge idea comes from. Just kind of looks like a bridge there. A way to advance this exercise, you have them put the feet together, challenges their core a little harder. Hold that position 3 to 5 seconds. The pressure's kind of in my shoulders here. I'm not using my elbows at all. Relaxing. And then next, we added the single leg balance. And that one, you just have them hold on to anything. Just kind of bend their leg up at 90 degrees. Hold that position for 10 seconds. And then relax and switch legs. And that's a single leg balance. That is phase 1 of the lumbar spine.